It is now my pleasure to introduce today's program. This program will provide a comprehensive overview of Bordetella pertussis and discuss the benefits of having molecular detection with the illumigene pertussis test by Meridian Bioscience during a community outbreak situation. I would now like to introduce today's speaker, Susan Aitken. She is the Operations Manager for Molecular Diagnostics Oncology Services at the Central Pennsylvania Alliance Lab in York, Pennsylvania. Susan has over 25 years of laboratory experience. She has been with Central Pennsylvania Alliance Lab for over 2 years and has held previous clinical laboratory positions at Eurofins Laboratory in Lancaster, Pennsylvania, Hershey Medical Center in Hershey, Pennsylvania, and spent 10 years with the Children's Hospital of Philadelphia. At this time, it is my pleasure to turn today's program over to Susan.
Thank you very much, Sarah, and good morning or afternoon, everyone. I'd like to first thank Meridian Bioscience for asking me to join you all today giving this webinar. And I'd like to thank you all for joining me as I share CPAL's experience handling our recent pertussis outbreak in Pennsylvania. CPAL, which is short for Central Pennsylvania Alliance Laboratory, is a nonprofit, non-competing, non-commercial laboratory whose sole purpose is to perform overflow and specialized testing for its members. CPAL was formed about 20 years ago as a result of 7 Central Pennsylvania hospitals coming together to have somewhat of a core reference laboratory whereby they could get their higher volume reference testing performed with less cost and a better turnaround time. So that is what CPAL does for our members. On today's agenda, I will be going through an overview of what our outbreak looked like, and then go into an overview of pertussis, its prevalence, treatments, the diagnosis and its challenges, guidelines that are currently in line, the history of Central Pennsylvania Alliance Lab testing of pertussis, and our transition into using the illumigene pertussis assay by Meridian Bioscience. So this case study started back in October of 2016, about the last week in October. We started seeing just a slight increase in our numbers, but what was of note was even though these numbers were increasing, our positivity rate was increasing as well. And by the first week in November, we knew something was going on when we were having 10 to 20 specimens per day come in, when our normal average would be about 1 specimen per day. Usually, over the course of a month, we test 28 Bordetella pertussis samples, and in November, we actually tested 893 Bordetella pertussis, and in December, 577. So, as can be seen, we really were slammed very quickly with an outbreak. And the first week of November, one of our technologists had come in and said that they heard on the news that the Pennsylvania Department of Health announced that there was a Bordetella pertussis outbreak in the Chambersburg and Shippensburg high schools. And the Chambersburg Hospital is the primary laboratory that we were receiving our specimens from. And Chambersburg is one of our member hospitals. So when we heard that, we were bracing for the influx of specimens. So what ensued after those first couple of days in the beginning of November was a dramatic increase in testing, with the peak days showing up to 70 specimens being tested per day. And the CPAL team really came together, everyone from our central processing department all the way through the managers and our administrative assistant, to make sure that these samples were tested and resulted within 24 hours of receipt of the specimen. And what we needed to do to make sure that this was completed was we adjusted our workflow to have at least one technologist dedicated to performing exclusively pertussis testing each day. And jokingly, after about the first week of pertussis testing in this exorbitant amount, we named that technologist the Pertussis Princess, because they were just doing so much testing every day. And during the peak of the testing, we actually had 2 to 3 techs assisting with the testing workflow, helping that main one technologist with putting specimens in order, prepping the tubes, labeling them, getting the testing actually started underneath the hood, and then when the results would come off of the instrument, helped with resulting, the calling of all of the positives, and faxing the results to the Pennsylvania Department of Health. And during this time, I was contacted by the PADOH to see if there was any way that we could expedite getting them our positive results in the most efficient way possible, so that they could then contact the doctors to have the patients quarantined. And so what I did was I contacted the Chambersburg Hospital to see if there was a way that we could get that patient demographic information to us quickly, so that we could then get it to the Pennsylvania Department of Health as fast as possible. And within 24 hours, the Chambersburg Hospital had their system totally down pat. And like, we would call the positive results, and before we hung up the phone, the patient results or patient demographics would be coming off of our fax machine, so we could enter them into the NED system. So everyone from central processing to the managers and administrative assistant really worked together to get everything in as quickly as possible, and it was an all-hands-on-deck situation. Sorry. So the benefits of having this type of testing available for the community, I know for us, we service 7 central Pennsylvania hospitals, and a lot of those hospitals do have respiratory panels available for their patients. But when you have an outbreak situation, knowing what you're looking for, it is really nice to have an assay that tests for that one thing that is being focused on. And the Meridian Pertussis screening test allowed physicians to positively identify the disease faster than many other tests that are out there. And early diagnosis and treatment definitely helps reduce the severity of the disease and helps quarantine positive patients to prevent spreading of this disease. So a little bit about the Bordetella pertussis organism. It is a fastidious, slow-growing bug that takes 3 to 6 days to form minimal colonies in culture. And this is a bacteria that releases toxins that damage the lungs and cause inflammation in humans. And Bordetella pertussis is the human pathogen exclusively responsible for the endemic respiratory disease whooping cough. The transmission of Bordetella pertussis is a very highly contagious organism. It is only found in humans and is spread from person-to-person contact, and is spread by coughing or sneezing while in close contact with others, who then breathe in the bacteria. And many infants who become ill are infected by older siblings, parents, or caregivers who may not even know that they have pertussis if they're in the early stages of the disease. And this, unfortunately, can increase the harm of an outbreak and quickly impact the entire community. The symptoms of pertussis usually develop within 7 to 10 days of exposure, and pertussis is characterized by 3 phases of illness: the catarrhal phase, the paroxysmal phase, and the convalescent phase. And this disease may not always present with the classic whooping cough symptoms, in which case the pertussis can be clinically indistinguishable from other respiratory illnesses. Looking into the 3 phases of pertussis infection a little closer, with regards to the disease progression, weeks 1 to 2 is stage 1 of the pertussis infection, known as the catarrhal stage. In this stage, symptoms include runny nose, low-grade fever, mild occasional cough, and it is during this time that patients are highly contagious. And it can look like just any other respiratory illness during this time. Stage 2, the paroxysmal stage, lasts from 1 to 6 weeks and may extend to up to 10 weeks. And the symptoms during this time include fits of numerous rapid coughs followed by the classic whooping sound. There can also be vomiting and exhaustion after the coughing fit, and this is called paroxysms. And stage 3 of this disease is called the convalescent stage, and this lasts about 2 to 3 weeks. And recovery during this time is gradual. The coughing lessens, but the fits of cough can return. And it is during this time that patients are susceptible to other respiratory infections. So what has changed, and why are we seeing an increase in pertussis? So what we do know is that vaccination or even infection with pertussis does not provide lifelong immunity. The vaccine does provide a high level of protection for the first 2 years, and infection only protects a person for a few years after having the disease. But of note is that there is a waning immunity in the pertussis vaccine, showing that they're only 80 to 90% effective. And the CDC has estimated that the Tdap vaccination protects only about 7 out of 10 people who receive it. So that's 70%. And there have been outbreaks and studies showing that sometimes the effectiveness of the vaccine could be as low as 50%, as can be seen in an outbreak that happened in Tallahassee, Florida in 2013. And reports of genetic changes in circulating Bordetella pertussis has raised concerns that this organism could be adapting to vaccine-induced immunity. The prevalence of Bordetella pertussis is estimated that there are 16 million cases of pertussis every year and almost 200,000 deaths worldwide. Almost 33,000 cases of pertussis were reported by the CDC in 2014, and this was an increase a 15% increase compared to 2013. And Pennsylvania contributed to more than 800 of those cases at that time. And just putting it into our 2016 outbreak that we experienced, our positivity rate was about 8%, and we had almost 100 positives detected in a 2-month period of time. This slide shows the changes in pertussis reporting by state. It's from the CDC, and as can be seen, about half of the United States showed an increase in pertussis. Treatment of pertussis. Younger children and infants are typically hospitalized because whooping cough is more dangerous for that age group. Older children and adults can usually be managed at home, and the treatment of choice for persons greater than or equal to 1 month of age is azithromycin, erythromycin, or clarithromycin. For persons less than 1 month of age or neonates, azithromycin is recommended for treatment because it has not been associated with infantile hypertrophic pyloric stenosis, whereas erythromycin has. The timing of the treatment of pertussis is very important. If treatment is started during that first 1 to 2 weeks before the coughing occurs, symptoms may be lessened. But this can be difficult because during that first 1 to 2 weeks in the catarrhal stage, it can oftentimes look like any respiratory illness. So that's why during an outbreak situation, if you know that pertussis is prevalent in the community and someone shows up with the coughing and respiratory symptoms during that time period, starting antibiotic treatment at that time could lessen the severity of the disease. If a patient is diagnosed late, however, antibiotics will not alter the course of illness. Persons are contagious from the beginning of the catarrhal stage, where you see the runny nose, sneezing, and low-grade fever, through the 3rd week after onset of coughing fits, or until 5 days after starting antibiotics. Complications of pertussis among adolescents and adults include sleep disturbance because you're coughing all the time, incontinence, rib fractures, and pneumonia. And pertussis is most severe in infants, with 57% of patients less than 1 year old hospitalized. And the complications among infants can include pneumonia, seizures, encephalopathy, hernia, subdural bleeding, and conjunctival bleeding. The diagnostic challenges included with pertussis testing can be affected by several factors. First, the sensitivity of the test. Also, the stage of the disease, whether antimicrobial administration has started yet, previous vaccination, the specimen quality, the transport conditions of those specimens, and the turnaround time. Is pertussis testing guideline driven? Well, the CDC, the Infectious Disease Society of America, and the American Academy of Pediatrics now recommend molecular testing for the diagnosis of pertussis. The CDC considers NAT testing an important diagnostic tool for the detection of pertussis, and molecular assays are increasingly being used for detection of pertussis because of its improved sensitivity and rapid turnaround time. Bordetella pertussis should be considered in all adolescents and young adults with a prominent cough. And just as a personal anecdote, about 5 years ago, my oldest son had the persistent cough to the point where he could not breathe. And I took him to the pediatrician, and I said, I think my son has whooping cough. And my pediatrician checked his records and says, no, he's been vaccinated. And I said, but it really sounds like whooping cough to me. And she did not think that it was. And we did not get him tested. Well, a few weeks later, a letter came home from the high school saying Bordetella pertussis was identified in one of the students there. Well, when that came home, my son told me that his friends were all blaming him as being patient zero and starting the entire outbreak. So I'm not really sure if it was an outbreak during that time, but I do know that my son was definitely affected by a prominent cough that lasted for weeks and weeks. So I would definitely recommend getting tested for pertussis if you see an adolescent or young adult with a prominent cough. So culture, the CDC states that although bacterial culture is specific for diagnosis, it is relatively insensitive, having a variable sensitivity of 12 to 60%. Optimal timing for growing Bordetella pertussis in culture would be to collect the specimen less than 2 weeks post-cough onset, and the culture can take 1 to 2 weeks to report a positive, and a negative result does not rule out pertussis infection. So using culture alone to diagnose pertussis infections will likely lead to underreporting of cases. Serology, unfortunately, cannot distinguish between active or post-infection. It is most useful late in the illness, and there are no FDA-cleared tests available. DFA, or direct fluorescent antibody testing, is even less sensitive than culture, and the CDC no longer recommends DFA for diagnosing pertussis. So molecular testing for Bordetella pertussis is highly sensitive, has a very fast turnaround time with results the same day. It is ideal for rapid diagnosis of pertussis, which is especially useful during an outbreak situation. And unlike culture, does not require a viable organism for detection of true positives. And it is not dependent on the patient's immune response like rapid serology tests. Molecular testing is recommended by the CDC, the IDSA, and the AAP for Bordetella pertussis diagnosis. The illumigene pertussis assay by Meridian Bioscience was the first FDA-cleared standalone molecular assay for Bordetella pertussis. It is an easy assay that was very simple to incorporate into our laboratory, and we were very impressed with the positive percentage agreement of 88% and negative percentage agreement of 98%, and we can routinely get results in less than 1 hour. I need to put in the caveat, however, when dealing in an outbreak situation, it usually took about an hour and a half to get everything through. And so when we had the increased numbers, it took a little bit longer because we had so many. And now the assay has been cleared for use with the eSwab medium, and that is actually what we prefer as the specimen of choice at CPAL. And going through the testing procedure, it is very simple. What we do is bring the eSwab medium to room temperature. We vortex it, take 500 microliters of the media and combine it with 50 microliters of pretreatment solution. We vortex that, and we take 25 microliters of that suspension and put it into the assay control tube. We vortex that and then insert it into a 95-degree heat block for 10 minutes. After that 10 minutes is up, we take it out and vortex, and then we dispense 50 microliters into the test device, put in a drop of mineral oil, close the tube, tap it to make sure that it's well mixed and the testing beads are dissolved, and then we insert it into the IllumiPro 10 test device, and it starts. 40 minutes later, we have our results. Very simple, easy to use assay. So CPAL's Bordetella pertussis testing history. So when I first came on to CPAL's molecular lab, they were performing a lab-developed test that tested for both pertussis and parapertussis. And this was started in February of 2013 and ran through August of 2015. And one of the first things that I was told by our technologists was that we needed to do something to help our pertussis assay because we had a lot of repeat runs on a very regular basis. And despite many of our techniques that were used to try and optimize this assay, it was clear that a new assay was necessary for us. And in beginning of May 2015, we came upon the illumigene pertussis assay by Meridian. And by the end of May, we had vetted out this assay and were beginning the validation of this assay at CPAL. And we were validated and live by August 2015. So a little bit about why illumigene pertussis works for us at CPAL. It is a small footprint, a rapid test, very cost effective because we had very little repeat testing, and it was very easily integrated into our facility and workflow. The instrument fits very nicely into a small space, and on a regular work day, fits into one of our molecular benches very easily while some assays are incubating or being run on another instrument. This can easily be incorporated. We have results in about an hour, and we find it very cost effective because we did not have the repeat rates as we did on our LDT. And in addition, when our volumes increased, Meridian decreased how much we were paying per test. In terms of the validation process, it could not have been easier for us to validate this assay, which started with a molecular application specialist coming on site to CPAL to train our technologists and start that validation process during the training. And our validation continued once the application specialist was done with his training. We continued on with our validation. All the validation materials were provided by Meridian, and then we actually did some additional in-house validations because we were experiencing some invalid test results during our initial validation studies. And the technical support team at Meridian was phenomenal in helping us work through that. They notified us that they were in the process of submitting the utilization of the pretreatment reagent to minimize or even remove invalid testing from the result process. And then in December of 2015, that pretreatment reagent was FDA approved, and we did yet another validation to make sure that we were on target utilizing that on a regular basis. And I need to tell you that in the almost 1,500 samples that we tested over a 2-month period utilizing the pretreatment reagent, we did not have even one invalid result to my knowledge. So I definitely am a proponent of this assay, especially during an outbreak situation. So one other thing I need to put out there, the Meridian team has been excellent in terms of providing the necessary reagents on however fast of a basis we needed it. They were right there for us. They had everything available. And I need to say that the CPAL team of technologists and staff really were phenomenal with how they came together and worked seamlessly to make sure that they could get the results out as expedited as possible. So I'm really grateful for Meridian asking me to be here today to share our experience with you. And with that, I will open it up for questions.
Thank you, Susan, for a very informative presentation. It's now time for our question and answer session. If you would like a question answered, please feel free to click the Q&A button on the lower left-hand corner of your screen. Type your question in the open area and click Ask to submit. Susan, our first question in regards to Pertussis. Have you received any pushback from physicians asking for a Pertussis result?
Yeah, that's a good question. What we ended up doing was we put a comment in the Pertussis result field stating that if the physician would want Pertussis testing, they would need to notify us within 7 days of collection, and we would forward that sample on to Quest, who does perform Pertussis testing. So we hold the samples for 7 days, and then we discard them after that time.
Thank you, Susan. As a reminder, if you would like to ask a question, please feel free to click the Q&A button on the lower left-hand corner of your screen. Type your question in the open area and click Ask to submit. Our next question, Susan, during your outbreak, how many instruments were you running? How many do you currently have?
Yeah, we have one instrument, and you can test 10 samples at a time on that instrument. And our peak day, we had 70 specimens.
Thank you, Susan. Next question, what specimen types are acceptable for the Pertussis test?
You know what, you'd have to go back to the PI to investigate everything. We utilized the e-swab because that was the sample type that we were utilizing before during our testing with our lab-developed test, but I think it is any non-charcoal medium swab, but check the package insert for that.
Thank you, Susan. As another reminder, if you have a question, please feel free to click the Q&A button. Type your question in the open area and click Ask to Submit. We'll give the audience a moment to submit their questions. Hi, Susan. Looks like we do not have any further questions from our audience. So we do like to thank all of our participants for joining us today. We hope you found this webcast presentation informative. This concludes our webcast. If you do have additional questions following the webinar, please feel free to reach out to your Meridian representative, or you can reach out directly to me. You may now disconnect and have a wonderful day.